I'm going to go over some respiratory conditions, and you want to assess the rate, rhythm, and quality when assessing a respiratory condition of a patient. The acronym REDO is useful for this. A patent airway is an airway that is open, unobstructed, and maintainable. You should look for and remove any obstructions if possible, suction if needed. Breathing is classified as adequate or inadequate. Adequate breathing is a normal rate, regular rhythm, adequate depth. But a patient may have respiratory distress, which is adequate breathing that requires supplemental oxygen, for example, from a nasal cannula or non-rebreather. Inadequate breathing, on the other hand, is breathing but not enough to live. Patient may have respiratory failure and need assisted ventilations, for example, with a BVM. Respiratory arrest is the cessation of respiration, so stopping of respiration. A patient in respiratory arrest needs artificial ventilations, for example, with a PFM, pocket face mask, or a BVM, or the like. Positional asphyxia is respiratory failure or respiratory arrest that is caused by body position that restricts breathing. So you got to be particularly mindful of the position the patient's in to make sure that the position's not restricting their breathing and leading to positional asphyxia. Some important signs to note in infants and children with inadequate breathing that are different than in adults are grunting. Children with inadequate breathing may grunt. Seesaw breathing. Seesaw breathing is when the chest and abdomen move in opposite directions. Nasal flaring, and also retractions, which is pulling in of muscles in various places. So grunting, seesaw breathing, nasal flaring, and retractions. Chemoreceptors are sensors that detect increasing carbon dioxide levels and decreasing oxygen levels. When this circumstance happens, they send messages to the brain to try and compensate, for example, by increasing respirations to increase oxygen intake and CO2 output, and by increasing the heart rate to increase blood flow and oxygen circulation. Hypoxia refers to insufficient oxygen in the body's tissues. Signs of hypoxia include cyanosis, altered mental status. The patient needs to be administered oxygen right away. Hypercapnia refers to high carbon dioxide levels in the body. Symptoms of this may be subtle and include headache and drowsiness. I'm going to go over some lung sounds. Snoring indicates that the airway is blocked. This could be due to poor muscle tone that allows the tongue, for example, to slide back into the airway. Wheezing is associated with a medical problem like asthma or emphysema. It's mostly heard during expiration. Gargling indicates fluids in the airway. If a patient is gargling, you may need to suction. Crowing is associated with a medical problem. It's mostly heard during inspiration, and it sounds like a harsh sound. Stridor is caused by airflow obstruction in the upper airway. It's a high-pitched sound. Crackles are associated with the alveoli opening or fluid in the alveoli. So, and it sounds like a crackling or bubbling sound. Fluids. Rhonchi is associated with secretions in the larger airways from conditions like pneumonia or bronchitis. Rhonchi has a low-pitched sound that resembles crackles. An embolism is an obstruction of an artery by something like an air bubble or a clot. A pulmonary embolism is an obstruction of a pulmonary artery. A deep vein thrombosis is a blood clot that starts in a deep vein, for example, in the leg or the pelvis. And some risk factors of developing this are sedentary ways or blood clotting conditions. Pulmonary edema can result from patients with heart failure or those exposed to low atmospheric pressure of high altitudes. So damage to the left side of the heart, which receives blood from the lungs, causes fluid to back out into the lungs. Patient with pulmonary edema may be pale, diaphoretic, have gurgling, crackling sounds, labored respirations, and a feeling of drowning. For pulmonary edema, the CPAP is useful to push fluid out of the lungs. It's also useful to keep the legs in the dependent position. If it's caused by atmospheric pressure, you need to adjust the atmospheric pressure. A pneumothorax is when the lung collapses from a weak spot, rupturing and letting air leak in. It causes sharp pleuric chest pain, tachycardia, tachypnea, low oxygen saturation, and CPAP is contraindicated for a patient with a pneumothorax. Instead, a catheter needs to be inserted to remove the air and allow the lung to expand. And that concludes this video on respiratory conditions.